I can't even begin to tell you how much dentistry has changed in the last 15, 20 years. Everything has become digital, and it's becoming so advanced. And with digital technology, it becomes better quality, faster turnarounds, just a better patient experience. Now, not only do we have 3D scanners now, so we don't take impressions on people. We don't pour up stone models because there's inaccuracies with that. We 3D print all of our models. We make in-house occlusal guards. We make in-house aligners, retainers, surgical guides for implants. We have three-dimensional cone beam, which to me, if you're not practicing with a cone beam, it's almost malpractice. If you're going to be doing root canals, implants, extractions, you got to see the tooth three-dimensionally. So in our basement, we have our own lab. We can turn around a crown in an hour and a half, the same crown that you're going to get from any lab. We can make it here, only better quality. And it means no temporary. It means coming back and getting your crown delivered with being numb still. So there's very little sensitivity. I can't tell you how much that has improved our quality to the point where I know what I'm delivering is spot on. Our lab is also completely digital, so we're getting into digital dentures now, and we can turn around a denture within weeks instead of taking months. So one of the hardest things to do in dentistry is to get a single tooth spot on. And you'll have patients that go back to their lab 3, 4, 5 times to get that, where we can do it in an hour because we have a lab technician comes up, stains, glazes, bakes it in the oven, and you got a perfect crown that matches. I make sure to reinvest in this practice every single year to stay on top of everything.